Foundation Radiology Group was created to transform radiology services in community hospitals by providing academic-level, subspecialty radiology support with Six Sigma efficiency and accountability. We've achieved this goal over the past 10 years through literally millions of dollars in investments, not only in technology, but also support staff, as well as developing one of the largest collections of academically qualified subspecialty radiologists in the country. We currently provide dozens of community hospitals and imaging centers with over 2 million annual studies. The key strategy our clinical and business team has achieved is to allow radiologists to focus solely on those parts of radiology service they alone can provide, interpreting studies and providing expert consultation to ordering physicians and to their patients. They do not perform administrative-related tasks that trained technologists or customer service experts can perform. As a consequence, Foundation Radiology has removed the single most important factor in radiology error, interruptions and distractions. By making possible an interpretive zone for radiologists, Foundation error rate is a fraction of normal. Far fewer errors are recorded than would otherwise be expected. Second, Foundation radiologists are able to become twice as productive because the usual delays, administrative trivia, and interruptions are removed from their daily professional work life. More studies, accurately read, doing what I was trained to do, is the reading environment we've created and support. The purpose of this film is to give you a visual description of the reading platform that Foundation has created that is transforming community hospital radiology.
Once a patient arrives in the client's imaging center and completes their imaging, that imaging is sent to our PACS system. Upon completion of the verification step, studies follow two paths. The RSS pull an X-ray draft template, or they place the cross-sectional exams in a work queue for our general extender and ultrasound extender teams. The general extender and ultrasound extender teams have a more extensive medical background based upon their specific modalities or transcription history. They utilize these skills to ensure our higher modality cases are prepped with an understanding of the actual imaging that was performed, as well as the patient's symptoms to ensure that adequate imaging was completed and proper patient history provided by the ordering physician and the technician. Allowing these cases to be interpreted by only these subspecialists helps to ensure the highest quality read for the ordering provider as well as the patient. The RSS team is responsible for answering any client calls 24/7, 365. This provides our clients access to our radiology staff any time of the day or night. The RSS are also responsible for expediting any critical cases. These potentially life-threatening cases are then made the most important exam in the organization at that moment. Once the superstat patient report is final, the RSS team then document every superstat and every critical finding.
So workflow management's primary objective is to get the right patient to the right radiologist at the right time. This is executed on two different levels, a bird's eye view and then an individual patient case level. Bird's eye view, we monitor the volume for each case type, stat, inpatient, routine, and those can also be broken down by subspecialty. On an individual patient case level, we work daily to troubleshoot any cases that might be getting held up in the process and assist in moving them to the next step. Workflow is able to enhance a patient's care by getting it to the right radiologist. That means the person with the correct subspecialty training and high quality reads. We are able to maximize each radiologist's contribution by pairing their credentialing with their strengths.
At Foundation Radiology, we utilize a multi-tiered approach to quality, leveraging external and internal resources. Externally, that resource begins with our hospital partners, who can submit any questions or concerns through our SAFRA submission process. Internally, our radiologists utilize a Rad Peer review platform, which prompts them throughout the day to provide peer review on randomly selected exams. All internal and external submissions are vetted, anonymized, and prepared for evaluation by Quality Counsel, our select group of 10 radiologists with varying subspecialties who convene on a weekly basis to blindly evaluate all clinically relevant quality concerns. At Foundation, we report all clinical quality details back to our clients through our detailed monthly quality reporting process. This robust, detailed report contains final outcomes of client-requested reviews and peer reviews specific to their facility. Quality data drives a large part of our frameworks reporting, which is our monthly report card for our hospital partners.
Foundation measured everything. They actually measure many, many important things simply are not on the radar for other radiology groups. And I can state pretty confidently that prior to joining Foundation, the radiology groups that I participated with were only in a sandbox when it came to quality. Foundation radiology is truly the major leagues. We employ something called the Rad Peer System. This is the system recommended by the ACR, the American College of Radiology. Our system allows for radiologists to submit any case for review. This system allows for any of our clinical partners to submit a case for a formal review. The radiologist whose case is being reviewed is subsequently notified in a very professional manner about the result. This feedback is personalized, it's individualized. Now, speaking on both sides of the fence, as both a reviewer and one who's always being reviewed, I can tell you the process is unlike any other I've experienced.